Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is oxygen toxicity and oxygen poisoning. So what is the definition and cause? Oxygen toxicity is the increased oxygen content in the tissues beyond certain critical level. It is also called oxygen poisoning. It occurs because of breathing pure oxygen with a high pressure of 2 to 3 atmospheric hydrobaric oxygen. And in this condition, an excess amount of oxygen is transported in the plasma as dissolved form because oxygen carrying capacity of hemoglobin is limited to 1.34 ml per gram. Now, effects of oxygen toxicity. Lung tissue are affected first with tracheobronchial irritation and pulmonary edema. And metabolic rate increases in all the body tissues, and the tissues are burnt out by excess heat. Heat also destroys cytochrome system leading to damage of tissues. When brain is affected, first hyper irritability occurs, then later it is followed by increased muscular twitching and ringing in ears and dizziness. Finally, the toxicity results in convulsions, coma, and death. Now, hypercapnia. Hypercapnia is the increased carbon dioxide content of blood and condition when hypercapnia occurs. Hypercapnia occurs in condition which leads to blockage of respiratory pathway as in case of asphyxia. It also occurs while breathing the air containing excess carbon dioxide content. And effects of hypercapnia. First effect on respiration. During hypercapnia, the respiratory centers are stimulated excessively. It leads to dyspnea. And effects on blood, the pH of blood reduces and blood becomes acidic. Now, effects on cardiovascular system, hypercapnia is associated with the tachycardia and increased blood pressure. There is flushing of skin due to peripheral vasodilation. Now, effects on central nervous system. During hypercapnia, the nervous system is also affected, resulting in headache, depression, and laziness. These symptoms are followed by muscular rigidity, fine tremors, and generalized convulsion. Finally, the giddiness and loss of consciousness occurs. Now, hypocapnia. Hypocapnia is a decreased carbon dioxide content in blood. Condition when hypocapnia occurs. Hypocapnia occurs in the condition associated with hypoventilation. It also occurs after prolonged hyperventilation because of washing out of excess carbon dioxide. Now, effects of hypocapnia. Effects on respiration. Respiratory centers are depressed, leading to decreased rate and force of respiration. Number 2, effect on blood. The pH of blood increases, leading to respiratory alkalosis, and calcium concentration decreases. It causes tetany, which is characterized by neuromuscular hyperexcitability and carpopedal spasm. Now, effects on central nervous system. Dizziness, mental confusion, muscular twitching, and loss of consciousness are the common features of hypocapnia. Now, asphyxia. Asphyxia is the condition characterized by the combination of hypoxia and hypercapnia due to obstruction of air passage. Condition when asphyxia occurs. Asphyxia develops in condition characterized by acute obstruction of air passage such as strangulation, hanging, drowning, etc. Now, effects of asphyxia. Effects of asphyxia develop in 3 stages. One is stage of hyperpnea, and stages of convulsion, and stages of collapse. First, the stages of hyperpnea. Hyperpnea is the first stage of asphyxia. It extends for about 1 minute. In this stage, breathing becomes deep and rapid. It is due to the powerful stimulation of respiratory centers by excess of carbon dioxide. Hyperpnea is followed by dyspnea and cyanosis. Eyes become more prominent. Now, stages of convulsion. Stages of convulsion is characterized mainly by convulsions, uncontrolled involuntary muscular contraction. And duration of this stage is less than 1 minute, and hypercapnia acts on brain and produces the following effects. One is violent expiratory efforts, and number two is generalized convulsion, and number three is increased heart rate, and number four is increase in arterial blood pressure, and number five it is loss of consciousness, and number three it is stage of collapse. Stage of collapse lasts for about 3 minutes, and severe hypoxia produces the following effects during this stage: depression of centers in brain and disappearance of convulsion. Development of respiratory gasping occurs. During respiratory gasping, there is stretching of the body with opening of mouth as if gasping for breath. And number three is dilation of pupils. Number four is decrease in heart rate. And number five is loss of all reflexes. Now, duration between the gasps is gradually increased, and finally death occurs. Altogether, asphyxia extends only for 5 minutes, and the person can survive only by timely help such as relieving the respiratory obstruction, good of aeration, etc. Now, dyspnea. Dyspnea means the difficulty in breathing. It is otherwise called air hunger. Normally, the breathing goes on without consciousness. When breathing enters the consciousness and produces discomfort, it is called dyspnea, and dyspnea is also defined as a consciousness of the necessity for increased respiratory effort. Now, dyspnea point is the level at which there is increased ventilation with severe breathing discomfort. The normal person is not aware of any increase in breathing until the pulmonary ventilation is doubled, and the real discomfort develops when ventilation increases by 4 to 5 times. And condition when dyspnea occurs. Physiologically, dyspnea occurs during severe muscular exercise. The pathological condition when the dyspnea occurs are: one is respiratory disorder, like dyspnea occurs in respiratory disorders characterized by mechanical or nervous hindrance to respiratory movements and obstruction in any part of respiratory tract. This dyspnea occurs in like pneumonia, pulmonary edema, pulmonary effusion, poliomyelitis, pneumothorax, severe asthma, etc. Now, cardiac disorders. Dyspnea is common in left ventricular failure and decompensated mitral stenosis. Number three is metabolic disorders. Metabolic disorders which caused by dyspnea are diabetic acidosis, uremia, and increased hydrogen ion concentration. Now, dyspneic index. Index is the index between breathing reserve and maximum breathing capacity (MBC), and breathing reserve is the balance or difference between the MBC and the respiratory minute volume (RMV). For example, in a normal subject, the MBC is about 116 liter and the RMB is 6 liter. Then the dyspneic index will be MBC minus RMB by MBC, that is 116 minus 6 by 116 into 100, that is 94.8%, and dyspnea develops when the dyspneic index decreases below 60%. So this is our today's topic. From next video we will discuss about the periodic breathing. Thank you so much for watching the entire videos. If you have any query or any doubt, you can comment down in the comment section, and do like, share and subscribe to my channel for supporting me and my channel. And thank you so much for watching the entire video.